Hey folks, how are you doing? Thank you so much for tuning in, and it's me, your mental health clinician, Dr. Debbie. And in a continuation with our sleep series, today we are going to be talking about sleep. And like the theme of this talk today is when we sleep well, we can do well and we will be well overall. It's just a concern about our overall wellness, that when we sleep well, our brain is well relaxed, rested, and everything is being taken care of by the headquarter, which is our brain during the sleep. It is really certain that we are going to do well, and we are going to just overall in our physical health, our mental health, our productivity, our business, our career, our family life, our relationship, our interactions with the entire world, with anything that we want to do. The overall wellness is very certain when we get the adequate hours of sleep that we're supposed to get based on our age, as we have discussed in one of the series. And we know that sleep impacts, both our physical and cognitive functions and our overall health, that as we have said before. And sleep and wellness, we have certain brain chemicals, that helps to coordinate like functions, executive functions. And then two of those, that is concerned with activity and our sleep is the gamma, the GABA and the glutamate. One acts like exciting, putting us on our toes, that we are always making us to be active, to be alert, so that we can attend to all what we need to do. And the other is the GABA, that's like acts like brake, in your car, in your vehicle. You have the accelerator, you have the brake. When the accelerator set the car in motion, you cannot just be flying like that, not to avoid maybe like a serious bend or like some residential area or curves and all that. Then you need to apply the brake, because we don't want to lose the control. And it's the same thing with the GABA, the chemical, the brain chemical that helps to slow down, that take it cool, yeah, and make us to go slowly. So this acting together, both the excitement and the one acting like brake helps, our system, our brain, to maintain crucial balance, and everything, is adequate, everything is in the right proportion. And that is when we say we can do well, and we can do well, and overall, everything will be well. And then when we link it also, when we are not getting enough sleep, the relationship between sleep and fatigue, we get tired, we get exhausted, and our cognition too is impaired because of this. And in such, when we are in that situation that we need intervention, medical intervention, behavioral intervention to enhance sleep. And it's not everything that we need to rush at first to sleep, except we are seeing certified practitioners that are going to assess, evaluate, and let you know the type of treatment that you will need. But the first line of treatment is the non-pharmacological interventions that we can use to enhance sleep, probably exercise, and we are going to regulate it. It should not be close to the time we're going to sleep, not to put us in that activity mode. And also we can use supportive therapy, we can use cognitive behavioral therapy, any concern, anything bothering our mind, any toxic environment, work related, relationship related. And in this type of psychodynamic therapy, where the professionals, they are able to listen, to sort it out, and put everything in each of the compartments or the baskets, and know and cancel based on the type of help that you will need, so that you can get adequate sleep. And some other things that we can use to enhance, like the activities that support good sleep, maybe like the food, like sleep hygiene, shower, go to sleep regular time, and then reduce our screen time, and then cool and calm environment to keep the room cool, dark environment, because when there is light, it's like excite the brain that, oh, it's daytime. And that is why in the morning time, even once you open the curtain, and then the morning sunrise, the brain is already alert, active, awake, and ready for the day's activities. So when we darken it a little bit, especially people that live in in the west or in the region that we have the long day during the summer, and then by 5 a.m. in the morning it's already, the sun is already up. You can use, darken the room by some dark curtains, and to reduce the amount of light that is coming in to interrupt our sleep. And also drinking as well, alcohol, it's like interfere and disrupt the brain circuit, and this messes up our natural sleep pattern. And also some sleep medications too, it has to be, if it is necessary at all after we have used the sleep and hygiene, it has to be in combination with that. Yeah, because when we do that, there are some medications that when we rely on that, it's difficult to have natural sleep. And no matter the type of sleep medication that you use, they are not able to produce the one that is actually natural, that is being induced by the brain activity itself, that you get to that phase of sleep that the restorative, the restful type of sleep that we look for, for us to be able to do well. Yeah. So, and then we need to limit also the daytime naps, to less than 90 minutes. When people are not sleeping well, they continue to feel sleepy, they are not active. So we make sure that if it is possible that you don't nap, and if it is necessary, maybe due to carryover from the previous days of fatigue and all that, you should not do that more than 90 minutes. That is 1.5 hours, so that you can get adequate sleep at night, the restorative, the restful hours of sleep that you need as human to function. And we have mentioned it the other time in the previous video. They just a recap and reminder, because sleep is essential. Everyone, young, old, whosoever you may be, babies, we sleep. And it's just like I said, sleep is like time, that is not based on the part of the world you live, the race, or whether you are young and old. It is essential, yeah, that everyone needs the sleep, and it is really related to our life and to our health as well. So from there, we have good mental health. If we have good sleep, we have good memory. It prevents long-term health consequences, because we are sleeping well, like cognitive decline and good immune function. It reduces the risk of accidents and injuries from fatigue. How many people have gone into really fatal accident because they were fatigued, they were tired, they were exhausted, and they were still behind the wheel driving, and then they just slip off, and before they know it, they ended up in the hospital, in the ICU, or some, unfortunately, they lose their life. Or not only them, the other road users that do not even know that this individual is already having distress due to inadequate sleep, and not fully alert to be driving at that period. But because we have to work, we have to sustain our life, we at times people push themselves to that. And also our sleeping room, we have to keep it cool. How is it? We have optimal good sleep when our room is cool, when it is dark, when it is quiet. It is very cozy and comfortable. You just wrap up yourself and make yourself comfortable, to enjoy good sleep. And also we should make our room where we sleep, it should portray a place of rest. Once we get to the room, we should differentiate our room from like study, or like study, or where we take our work, to do some work, carry over and all that. No, room should be designated only for rest and sleep. And the brain interprets that once you get to your room, to your bedroom, to your bed, there's no other, it's time to sleep. Yeah, the brain is already conditioned for that. And definitely before you hit the bed, there are some people that within minutes, few minutes, 5, 10, 15 minutes, they're already cruising, enjoying their good sleep. Yeah. So, and also, yeah, to make it comfy, with good curtains that will create the darkness. And because like naturally, in the daytime, once it is getting to the evening time, the darkness activates the parts of the brain that starts to produce melatonin. is part of the brain chemicals that, it enhances sleep. So the darker the day, like from 5 o'clock, 6 o'clock, 7, and that is why we have reduced hours of sleep during summer, because at times, like in some parts of the west, 9 p.m., 11 p.m., it is not still as dark, unlike during the winter time, that maybe like in some places 3 p.m., 4 p.m. is already dark. People are already in sleep mode. So, but during summer, or the other people in other parts of the world that do not have, the time zone changes and all that, you can darken the room and put out the light, the bright light, so that your brain can be activated to produce the sleep chemicals, the melatonin, and you can really have good sleep and make yourself comfortable. Get soft, cozy pillows, blankets, and let it be quiet. It's not the time when we are going to be listening to noisy movies, music and all that. Music can help to enhance, but it has to be cool, soft music, depending on your choice that you like. And maybe if you're in an environment that you are not able to have that privilege of creating such quiet, cool environment for yourself, you can use earplugs, or white noise. There are machines which are not expensive that you can get to buy online, that it will cancel noise cancellation, any noise you don't want in your environment, or earplugs that are very cheap and easy to get, so that you can have that quietness and enjoy your sleep. Also, you can remove anything that will stimulate, make your brain to be active, like studying, writing, work material, or any game or anything like that. You just want to enjoy that hours that you need for your sleep, because the outcome is when you sleep well, you are going to do well, you are going to be well physically, you are going to be well mentally, and your output and your productivity. And also it saves life, because you're not going to get tired and become fatigued and get into accident. People get into accident not only driving, but even at times walking, they can just miss a step and all that, because they are really tired. The brain is tired, the brain wants to rest. I hope you learned something, and it's me, your mental clinician, Dr. Debbie. You can check my bio and other platform of the social media, like on the Instagram, to connect and learn more generally on mental health. Yeah, because I want everybody to do well, to live well, and enjoy life well. All right, thank you so much, and until I see you in the next video, take care and bye.